Welcome to the Living Healthy with COPD YouTube channel. Subscribe to get daily videos. Also hit the notification bell, and if you like the video, hit the like button. We make videos all about what it is like to live with COPD. The topics range from supplements, diet, exercise, spirituality, medications, and overall healthy lifestyle. Enjoy.
COPD-related cognitive impairment. Unlike other forms of dementia, in addition to the burden imposed by chronic obstructive pulmonary disease, COPD, patients often face CO-occurring conditions such as diabetes, coronary artery disease, and osteoporosis. Emerging research also indicates that cognitive impairment is a common comorbidity in COPD, with studies showing prevalence as high as 52% in this patient population. A number of suggestions have been made regarding the underlying pathophysiology, including cerebral hypoxia, loss of hippocampal volume, and inflammatory mediator-related neuronal damage, according to the results of a study published in Open Research. Pulmonology Advisor: what is known thus far about cognitive impairment in COPD, and what do your findings add to our understanding of this issue?
Dr. Morris, there is increasing evidence in the published literature that patients with COPD are more likely to have cognitive impairment. What we do not know is whether people with COPD are more specifically affected in certain areas of cognition. Using a validated cognitive tool, we found that specific areas of cognition were affected differently in COPD compared with people with known Alzheimer-type dementia. We also found that when we compared the COPD group with the healthy control group, patients with COPD were significantly more likely to have cognitive impairment. Although these results are interesting and fit with results previously published in the literature, we must bear in mind that this was a small study and there could have been confounding effects.
Dr. saying, patients with COPD have an increased risk for neuronal injury, either due to hypoxia or associated comorbidities, especially cardiovascular disease. Recent studies suggest that up to 77% of patients with both COPD and hypoxemia have some form of cognitive impairment. 3 In a population-based, prospective cohort study of individuals aged 70 years and older, the Mayo Clinic study of aging, COPD was associated with a significant increase in the risk for incident mild cognitive impairment, MCI, specifically non-amnestic MCI. Not MCI.3. The results remain significant after adjusting for several important covariates. Further, there was a dose-response relationship. The risk for MCI increased with the duration of COPD. Thus, highlighting the importance of COPD as a risk factor for MCI may provide a substrate for early intervention to prevent the incidence or progression of MCI, particularly not MCI.
Pulmonology Advisor: how should clinicians screen for and treat these issues in practice?
Dr. Morris, my approach to this is to be more aware that people with COPD are at risk for cognitive impairment, and to consider testing for this if signs are shown by the patient and the patient agrees to be screened. Although there is no cure for cognitive impairment, early diagnosis and intervention could mean more appropriate support structures for individuals who are affected.